Hi, everyone. Thank you for joining us today at the Centers for Medicare and Medicaid Services with the Office of Minority Health Minority Research Grant Program and our partner meeting. My name is Ashley Petticord Austin, and we're so pleased to have you join us today. You can go ahead to the next slide. Here's our agenda for today. We will begin with an overview of the Minority Research Grant Program, followed by details on the 2022 Notice of Funding Opportunity, including eligibility requirements and how to submit an application via the grants.gov website. Following these items, we'll share some insights from some recent grantees. And with any time left, we'll conclude with a Q&A session. On this slide, we also have instructions regarding accessibility for today's event. To access the live transcript feature, go to the menu at the bottom of the screen and click the live transcript icon. After you click the icon, click on View Full Transcript, which will allow closed captioning to appear at the bottom of your screen. The transcript will show on the right-hand side. Next slide. So before we dive into the overview, we did want to provide some background information on CMS and our office that hosts the program. CMS is the largest provider of health insurance in the United States and responsible for ensuring more than 150 million people are supported by the CMS programs that can get care and health coverage they need and deserve. Our office, the CMS Office of Minority Health, is one of 8 minority health offices within the larger Department of Health and Human Services. We serve as the principal advisor to the entire CMS agency on the needs of minority and medically underserved populations, including racial and ethnic communities, people with limited English proficiency, lesbian, gay, bisexual, transgender, and queer persons, persons with disabilities, persons in rural areas, and those otherwise affected by persistent poverty or inequity. Now, I'd like to introduce our next speaker, Brian Young, who is also my colleague from the CMS office.
Thank you, Ashley. Hello, everyone. My name is Brian Young, and I am a public health advisor within CMS's Office of Minority Health. I will be providing a brief overview of the Minority Research Grant Program. So for today, in order to shorten that, I will just be saying MRGP. So the MRGP program supports CMS's efforts to advance health equity by increasing understanding and awareness of health disparities, developing and disseminating solutions, and implementing sustainable actions. Next slide, please. So the MRGP, which is administered by CMS's Office of Minority Health, which I'll be saying OMH, supports researchers at minority-serving institutions that explore how CMS can better meet the healthcare needs of the populations we serve. And like Ashley mentioned, some of our focus populations include racial and ethnic minorities, LGBTQ+ folks, individuals living in rural areas, persons with disabilities, and persons adversely affected by poverty. Next slide, please. For the last 2 decades, CMS has provided Minority Research Grant Program grantees with funds to further health equity research that supports researchers pursuing topics that impact minority populations, investigate the root causes of health disparities, and fosters the dissemination of grantee research within CMS programs. The grant program gives the opportunity for our communities to benefit from the research, but they are also fantastic opportunities to help minority-serving institutions and health equity researchers grow their work and portfolio. Next slide, please. So next, we're going to review some of the program's goals. The first goal of the program is to develop capacity at minority-serving institutions to research health disparities and social determinants of health. The support for minority research, excuse me one second, something got in the way. The support for minority researchers help them grow to a point where they can conduct research independently and be competitive for other major grant support. Next slide, please. The second goal aims to understand the root causes of issues that lead to health disparities and identify replicable interventions. Institutions investigate these root causes by exploring local conditions and populations, specifically medically undeserved populations. Next slide, please. So lastly, the research funded by the MRGP disseminates best practices for addressing health disparities, providing culturally competent care for all patients. CMS reviews these findings and best practices to strengthen CMS's programs and policies. Next slide, please. So now I'd like to talk about academy and research funding. We know that supporting the research enterprises is a high priority for major research institutions, which includes providing guidance and stewardship for the research community at large. We also know that these resources directly contribute to the academic mission of these colleges and universities by providing support for obtaining sponsored project funds and managing sponsored project activity. Sponsored projects enrich the academic community by providing revenue to establish new programs, conduct faculty research, and provide instructional and other services. In addition, sponsored project funds support professional growth for faculty, postdoctoral students, graduate and undergraduate students, and staff. The MRGP is an opportunity to continue in this tradition while closing the gaps on health inequities. Next slide, please. I am happy to announce that on June 2nd, CMS OMH released the 2022 MRGP Notice of Funding Opportunity. We are now accepting applications via grants.gov, and the deadline for applications is Thursday, July 28th, 2022 at 3 p.m. Eastern Standard Time. This year, we can award 3 grantees, each getting $333,000. Now, before we provide a demonstration on how to properly submit an application through grants.gov, I would like to go over some of our eligibility requirements. Next slide, please. So applications undergo a thorough review process, evaluating the level of innovation, community collaboration, and scientific rigor. To be eligible, researchers should focus on developing suitable interventions for health disparities impacting minority populations. Health equity researchers with suitable projects from the following type of minority institutions may apply. So HBCUs, historically Black colleges and universities, historically Hispanic serving institutions, HSIs, Asian American and Native American Pacific Islander serving institutions, ANAPIs as we call them, and tribal colleges and universities, we call those TCUs. So for more information on the eligibility requirements, you can visit the program's webpage listed on the screen. I would like now to introduce my colleague, Sharon Jernigan from our Office of Grants and Requisition Management team. Sharon, I'm gonna pass it over to you.
Thank you, Brian. My name is Sharon Jernigan. I am a grant management specialist with the Office of Acquisition and Grant Management, and I will be giving a brief overview of the application process with some best practices to keep in mind as you move through the process. Thank you for going to the next slide. Anyway, okay, all application materials are available on grants.gov. Applications must be submitted electronically through the website. Application submission information can be found in Section D and Appendix B of the NOFO. Applications must be submitted electronically through grants.gov by 3 p.m. Eastern Standard Time, July 28, 2022. Applicants will be able to download a copy of the application packet, complete it offline, and then upload and submit the application via the grants.gov website. Upload early. It is very common for it to take longer to upload an application. The later you wait, because there are more applicants attempting to upload their applications at the same time. So even if you start at 12 noon, your application could take up to 3 o'clock to upload. In addition, applicants should double check their applications before the due date to ensure all required documents have successfully uploaded to grants.gov. Before your organization can apply for a federal grant, there are several steps an organization must complete outside of grants.gov prior to submitting an application. An organization is an entity that submits grant applications on behalf of a group such as a state government, non-profit organization, or a private business. Beginning with the forming of a legal entity with an employee identification number, or the EIN, register with SAMS.gov, the system of award management. Ensure that you are registered with the SAMS database in order to submit an application. I strongly encourage you to do so because it could take up to 5 weeks to complete. As of April 4th, the DUNS number, the Data Universal Numbering System, was replaced by a new non-proprietary identifier, which can be requested and assigned by SAMS.gov. The new identifier is being called the Unique Entity Identifier, the UEI. Finally, register with grants.gov. The authorized organizational representative, or as we call an AOR, must submit the application to grants.gov. The AOR officially submits an application on behalf of the organization. The AOR is the individual named by the applicant/recipient organization who is authorized to act for the applicant/recipient and to assume the obligations imposed by federal laws, regulations, requirements, and conditions that apply to grant applications or awards. The electronic signature of the individual who is logged in and submits the application to grants.gov will automatically populate throughout the application. The electronic signature must match the AOR named on the SF424. What is a grant or a cooperative agreement? A grant or cooperative agreement is defined as the transfer of money, property, services, or anything of value to a recipient in order to accomplish a public purpose. The amount of funding for each cooperative agreement or grant award will depend on the individual's recipient's need as demonstrated in its application submitted in response to the NOFO. All applications will be submitted through grants.gov. Please familiarize yourself with this vehicle. If you go to the homepage, there is a menu at the top, and there are videos that will familiarize you if you're not currently familiar with that system. Also, I encourage you to watch those videos even if you have not been on grants.gov in a while, because the site has updated in the last year. Grants 101, or grant on the grants.gov website, is an overview of the grants process and how you can apply through the grants.gov system. Grants.gov is loaded with information, so please take advantage of all of the resources available on the site. Now I'd like to turn it back over to Brian. Next slide, please.
Thank you, Sharon. I really appreciate your insight. So now we'd like to play a short video from one of our current grantees doing health equity research at Meharry College. Meharry College is an HBCU in Nashville, Tennessee.
One of the things we're seeing in the research space is sort of the issue with big data and the use of new technologies and analytics from artificial intelligence and machine learning. And we want to be able to introduce some of the early stage investigators, particularly at our minority serving institutions, and to help them become familiar with these techniques and with the CMS Medicare and Medicaid data. The Medicare and the Medicaid data, is probably the largest data set that's out there, again, for conducting health services research. And we hope to be able to train young investigators to use this to conduct health disparities research and to be able to look at differences across racial ethnic groups by using the claims data and the pharmacy data and for prescription drug data, those sorts of things. And researchers in general, in terms of biomedical sciences, are underrepresented. In terms of minorities, are underrepresented. And I think this is important because it provides a different perspective and interpretation of data, and that bring a different perspective to that. So, in terms of training minority investigators in the area of health disparities, we're hoping to be able to shed some new light on issues that have been looked at previously, but from different perspectives.
Next slide, please. So next, we'd like to show you one more video from one of our current grantees at Florida A&M University.
As an HBCU, Florida A&M University has had a long history working with the community and with minority populations. I looked at the numbers, and from the numbers that I've seen, the Medicaid population here in the state of Florida, especially when it comes to births or deliveries, over 60% are African American and 8% are other minority populations. So if you're trying to make a difference and have an impact on that particular group, then that group is a group where generally they're underserved and they have poor health outcomes. So that's actually where you want to start. Much of the research grant that I have is actually dedicated toward working with students and getting students involved in this research so they can carry on even long after I've gone and they can train other people. So I think it's important that grants also provide an opportunity for other students that are interested in this type of work to be involved. We have students who come back and they have already obtained a medical degree and they come back and they get a degree in public health. And we also have students who are here who go on from our public health program to get medical degrees or dental degrees. We even have a few students who go on to get veterinary medicine degrees. So it is an opportunity for students to learn how disease works in a population and bring that knowledge to working as a physician to individuals, but it gives them a broad perspective of what disease looks like in a population of people and how to prevent some of the diseases that we see, especially some of the more lifestyle types of diseases. And public health does focus on trying to prevent those diseases instead of treating them after they have developed. And we feel that people who have a public health focus can work to improve not just the health of the individual, but health of the entire community.
Thank you. Next slide, please. So now I'm going to turn it over to my colleague, Brianna Braxton. Brianna, the floor is yours.
Thank you, Brian. Sorry, 1 second. There's an echo. All right, thank you for bearing with us with the technical difficulties. So next we will move into the question and answer portion of the meeting. So to ask a question, you can submit your question using the Q&A feature and at the bottom of your screen. And we will answer as many questions as time allows. The questions listed on the current slide are meant to serve as a prompt. So if you have any questions, feel free to put them in the Q&A box now.
As we wait for questions to come in, I'm going to send the link to the website where you can find everything through the chat, which is go.cms.gov/minority research. So that's a website that's dedicated to this grant program to give you some of that background information again, and talks again through who would be an eligible MSI, minority serving institution.
As a reminder, if you would like to submit a question, you can use the Q&A feature at the bottom of your screen. You can just type in your question there, and we're happy to answer.
Sean, would you like to add anything?
Thank you, Brian, for that question or giving me the opportunity. What I would definitely share with any of our listeners and anyone that's within a network that is eligible for this, I think this right here is a great time for health disparities research, and more importantly, this opportunity from the Centers for Medicare and Medicaid to actually be one of those opportunities for developing your research portfolio. I think that you will find—
We still have some time in the webinar, so if you have any questions, you can submit them using the Q&A feature at the bottom of your screen.
Sean, why don't you go ahead while we look to see if any Q&A come in. As a reminder, you can hit the chat feature. It might not be open to you all, but the Q&A, you can go ahead. But Sean, go ahead and finish your thoughts while we see if any Qs come in, and then we'll go back to the Q.
Just that if there is an opportunity for you to share with any of your colleagues or within a network, we definitely recommend that you share the notice of funding opportunity widely, particularly for any junior researcher or established researcher that is looking to really look at populations that are medically underserved and what they can really do to disrupt some of those key issues. In addition to that, if there are no questions that you all come up with during the session, we actually do have other ways that you can get in contact with us, and we'll be more than happy to offer guidance that is fair and just to any applicant, but more importantly, specific to what we can actually do as an Office of Minority Health. We're more than happy to help.
Thank you, Sean. And that's actually the perfect segue into the first question that came in. Haley, if you're able to advance the slides to the very last one, I think the visual will be an assistance. But there is a question in the chat. Is there a program coordinator we can talk to in case we need clarity about whether a research idea is appropriate? And so the short answer is yes. And you're staring at most of them right now. But we do have a TA email box. If we advance one more slide, if you don't mind, so that folks can see it. So it's in the bottom middle, Health Equity TA at cms.hhs.gov. And I'll put that in the chat in just a second. But any questions about the grant program can go to that mailbox, and they're usually sent to Brian and Sean. So I'll let you two talk about how that works.
To also piggyback on that question, we will happily accept that question. However, we do not tell you what to research. Our intention is to discover any innovation and anything proposed will get a fair review by our expert panel to see how it will actually be applicable to any of the policies, programs, or products that we actually house within CMS. And so, again, we will not tell you what to research, but all ideas are definitely encouraged and welcome.
Great. Brian, was there anything you wanted to add to that in terms of what kinds of questions we can take, or Sharon, you're certainly probably a good person to answer some of those too.
Nothing.
Okay. Well, we do have time for some Q&A. We won't keep everyone if there aren't any other questions, as there is, of course, that mailbox where you can always reach out to us. But I did think, Sharon, would you mind talking through again the deadline? Because we know the deadline itself is pretty clear, but it's July 28th at 3 p.m. For the grants.gov site. But I think it was important to reiterate what you had mentioned about making sure that you start that before 3 p.m., that everything is loaded in, and that you can double check it all before 3 p.m., correct?
Yeah, because we've had some situations where folks will start uploading their applications, and this is the last day, they're uploading at the last minute, and a lot of the times, once 3 p.m. hits Eastern Standard Time, everything is shut down at that point, and you're considered late. And then at that point, you're not going to be allowed past the initial, or allowed to move forward or advance to the next phase of the process. So it is very important. I don't work in grants.gov. I'm not a, grants.gov is a completely separate entity. So I really can't tell you why it works out that way, but I'm assuming that many people are trying to get their applications in before the deadline. So the congestion can cause a buildup in congestion and slow the process. So it is best to upload early. And if you can get it in early, but go back and check, make sure all required documents are in there and have uploaded correctly. And I cannot stress to you the importance of the business assessment, the questionnaire that is a part of the NOFO. We've had folks, they thought they had uploaded and is nowhere to be found. And once it comes over to OAGM and it's not there, then that's where everything stops for that person. So upload early. That I just cannot stress enough to you, just to upload early.
Thank you. I appreciate that, because I feel like that's so important. And you mentioned a good point as well. It's 3 p.m. Eastern time. So if you're on the West Coast, please note. So we did have one more question in the chat related to reaching out to the team. The person was wondering if they might be able to send the question about whether their research topic was related to something that might be a fit for this grant program versus another vehicle, such as the NIEHS, which I forget exactly what that stands for, but is that something that anybody could speak to, or certainly the eligibility requirements I know are written out, but did anybody want to speak to that, Brian or Sean, maybe?
Having been in that world, what I would say is this is one of those opportunities to really explore exactly what funding mechanisms are out there and what you stand a great chance of actually getting scored. And what I would say is, from any early investigator or investigator period, try not to eliminate yourself from this mechanism, as opposed to submitting it and letting the expert panel give you a score and make that decision. Again, as the TAs for the program, we're not going to be able to tell you whether or not our expert panel will say yay or nay. It won't be until after they receive it. What we will advise primarily on is the eligibility criteria. If you are an appropriate institution, what the makeup of the team should be, could be, or whatever it is that you're pitching in that area. The research topic, what I would say, we're hoping that people are submitting ideas that would actually lead to better outcomes for populations that we serve. And that is our hope, that you're able to tell the story and the research outcome that will appeal to our reviewers. That's the best way I can explain it. It'd be hard for us to literally tell you that, what other funding mechanisms might be a better fit per se. Unless, of course, you're submitting something related to bench science. We don't do bench science.
Thank you, Sean. Anyone want to add anything?
I have one more item in reference to what I spoke about. The authorized organizational representative, the AOR for the organization. When submitting the application, the AOR is supposed to be the one submitting the application. Generally with the institutions, it's usually an assistant. The application cannot move forward until the SF 424 and SFLL, which is a lobbying form, is signed by the authorized organizational representative. So keep in mind when you're doing the completing the application process, that whoever is logged on, which is supposed to be the AOR, their email will sign off on as the AOR. It has to be the AOR, or that is not a disqualifying, but it halts the process. So I just wanted to throw that out there really quickly. Thank you.
Thank you, Sharon. That's a good tip, especially for planning ahead purposes. Well, we'll do one final call to see if there's any further questions. If not, though, we thank everyone for your time today. And of course, you can always reach out to us during this process. And we hope that you will help us spread the word. This is a fairly grassroots type of grant program. It's not one of the big, huge ones that people hear about all the time. So we try and get everybody that might be potentially eligible to help us, spread the word, send it wide, and you never know who might be interested. So it goes out through our listserv, and you'll see it on the CMS social channels. But of course, there's the website is always up as well, so you can send that, forward it to colleagues. If you see it come through the CMS Twitter or LinkedIn, hit like or repost for us to help spread the word. The more the merrier. This is one of our biggest opportunities this year, because we do have more funding and more spots that we could potentially have an award for. So we're very excited about that on our end, but of course, the more applications, the better. So with that, it doesn't look like we have any further questions come through. So I think we can go ahead and wrap up, and we very much appreciate everyone's time today. And as always, of course, you can reach out to us. We provided the Health Equity TA at cms.hhs.gov. It's a wonderful way to reach the grant program pretty directly. And of course, you can always send us any questions. Sign up for our listserv so you can stay on top of all of the health equity related initiatives. And of course, we'll be sending out some reminder emails about this particular grant program ahead of the deadline. Thank you all for joining us today, and we hope you have a great rest of your day.